Okay, so this is the appendix. So the entire appendix is enlarged and swollen. So you can see that the diameter is actually increased compared to normal. And hyperemia just means sort of redness. And you can see that these are the areas that appear red. And also the vessels are much more prominent because of vascular dilatation and congestion. Okay, so pyelonephritis, here you can see multiple foci of small yellowish lesions, which are actually predominantly located in the cortex. And this one here is viewed from the outer surface. So it's actually covered by the capsule of the kidney, but you can see some yellowish foci studding the surface as well. Okay, so this is actually the normal hilum where the vessels come in. Okay, so the gallbladder, the entire gallbladder actually is enlarged. So when we talk about enlargement or a reduction in size, usually we refer to the entire sort of organ or structure. So the entire gallbladder here is depicted, and the gallbladder has been opened. So all along here is actually the wall, and the wall is thickened because you can see that this is yellowish and thick. So usually the wall of the gallbladder is really thin, kind of around 1 to 2 millimeters, and the surface is usually very greenish and velvety in appearance. So the appearance here is slightly more sort of fibrotic and reddish, and here is also quite thick, like almost around 5 or 6 millimeters. Okay, so for pulmonary tuberculosis, so this is the lung. It has been sliced open, and this is also the hilum. So these are normal structures. The airway tree and the vessels come in through the hilum, but what you want to see are these areas of cavitation. Okay, so cavitation simply means formation of cavity. So you've got spaces and holes. So these irregular sort of spaces, these are your cavitations. Okay, here as well, and you can see a lot of these cavitations are surrounded by sort of yellowish consolidation. So areas which appear a bit more solid and creamy in appearance, like I'm showing in and around here. And you can see specks of kind of lighter and brighter golden yellow in appearance. So these are the areas that contains necrosis as well. Okay, so hypertrophic scar, this is quite obvious. So you have a line where the scar or incision was made, and now there is an elevated scar. So it should be just a normal scar, should be flat and basically follow the line of the incision, but this one is elevated and it appears quite red. When you compare it to the keloid, this one is much more elevated and nodular, and the difference between keloid and hypertrophic scar is keloid tends to be larger and will be seen as expanding beyond the site of the injury. So you can imagine, like at the ears, probably the injury is just related to ear piercing or a small sort of area of injury, but the scar has grown beyond the size and the confines of the injury that had happened.